What's up, everybody? My name's Trey, and welcome back to another video. So, if you don't know, I recently tore my ACL, and I have to have reconstructive surgery to build a new ACL from different parts of either my body or somebody else's body. And this will probably be the biggest decision that you have to make if you are somebody who's about to have surgery, or you feel like you hurt your ACL, or you're just kind of interested in the different options that you have when it comes to ACL surgery in general, and that's which graft should you choose. So there's a couple different variations of grafts. There's grafts from your own body and grafts from other people's bodies, I guess. So you have your patella tendon, your hamstring, or your quad, and then they also have what are called cadavers, which are body parts from deceased people or donors that they would use their stuff to rebuild your ACL. I did a deep dive. There's pros and cons in both instances. So I will kind of break down what my thoughts are. I would love to hear your thoughts in the comments. And if you are somebody that's new to the channel, make sure you hit the subscribe button and notification bell to get notified every time I post a video. And leave a comment in the comment section down below. Have you had ACL surgery? Are you thinking you need it? Or did you just come here because, well, you want to support me on my journey? Because I appreciate that. So now when it comes to the ACL, basically it's going to be a graft of a different muscle that's going to reconstruct your ACL. So you can kind of think of it like this: is if you have a flat tire, they can either patch that tire with itself, or you can get a new used tire. It's new to you, but it's used in terms of other people, I guess. Um, the stuff that I found has me terrified of every option, to be completely honest with you. But I do know somebody who has had ACL surgery and opted for the cadaver, which is using somebody else's ligaments, tissues, tendons, whatever, to build your own. And he says he's fine in terms of rehab sucked, but he's able to squat to depth, he's able to run, he's able to cut, he's able to do things. But everything I've seen for the most part online says don't do that option. And it's weird because the only option that I have a real life example for, the internet is telling me not to do. So this is kind of what I've taken away from it. So if you do your patella tendon graft, it's basically a bone patella bone graft, which is going to remake the ACL. Now, the best pros that I found is it's probably going to be the strongest, it heals the fastest, and it's going to be great if you're trying to get back into contact sports. Now, the thing is, I'm probably never going to try to play sports again, if I'm being completely honest with you. So I genuinely don't care about playing contact sports again, but I would like to be able to. Just because I don't do it doesn't mean that I won't have the thought, and I would like to be able to do it, if that makes any sense, I guess. So what I've seen, the patella tendon graft seems like it's going to be the strongest and the most reliable. Now, the cons are, it seems like a, I was going to throw out some numbers, but the majority of people who actually have this surgery have knee pain, and they can't like put pressure on their knee, so they can't take a knee on the knee that they had surgery on. Not a huge fan of, because I'm trying to go for as little pain as humanly possible, because I would really like my rehab to not be pain related, it be like, I don't know how to explain it. It's like, I don't want there to be pain at the site that I'm trying to rehab. I just want it to be weak, and I have to grow strength, and not have to be like, oh, my knee really is throbbing, feels like there's needles in it. So I'm pretty sure I'm not going to pick that one, because I just don't want knee pain. So the second option we have is the hamstring tendon graft, which is basically taking tendons from your hamstring, rebuilding your ACL. Um, This graft seems to be better for people who actually want to keep their quad strength. They don't want as big of a scar when it comes to their actual surgery. And an interesting thing about this one specifically is my cousin had this surgery like 2 years ago, and she's able to run and cut and jump and be normal. So that's idea. But the major con with this one is it's a really slow healing process because you are risking strength in your hamstring, which means during physical therapy, you have to strengthen not only your ACL, which is brand new, your quad, because it hasn't gotten really any type of work until surgery, then also your hamstring, because you're taking tendons from your hamstring and using it to rebuild your ACL. So that kind of sucks. And we also have the quad tendon. Now, everything I've seen on this one says it's a newer operation. It's growing in popularity. Um, it's a thick graft. It's a good option if you previously had ACL surgery, and it's less painful than patella in most cases. But it's going to have the largest incision point, and you're potentially going to make your quad weaker. So, also, don't know about that one. I know for sure I'm not picking the patella tendon. Like, that's 1000%. I do not want knee pain. So, anyone that says we will give you less knee pain, I'm all about that. And then the last one that we have is the cadaver. So, like I said, the cadaver is taking tissues from a deceased person or a donor. Now, the biggest problem I see with this one specifically, obviously, they're dead, right? So, I'm assuming their tissues aren't going to be as strong because they're either going to be old or they might be sedentary, because if you're active, you wouldn't be dead, right? But pros are it's shorter recovery time. There is no donor site pain because I'm not having surgery on a different part of my leg to fix my leg. And then I also have a faster recovery time. But the risks seem to be substantial. So there's a higher risk of failure when it comes to the actual graft itself, because it's not your own body. It's a foreign body that's entering your body. It's a longer time to fully incorporate like your recovery and your range of motion. And then there's also a rare chance that you might reject what's in your body, or you could get a transmitted disease, which I look, if I go in for an ACL surgery and then I come out with some disease that I can't get rid of, I'm just going to be so sad. Like, I wouldn't know what to do with my life. I already feel like I don't because I can't move, but whatever. But this one says it's better for older patients who have low activity levels and people who want to avoid graft site pain. The problem is I'm not old. Well, okay, I am old, but I'm not that old in terms of like I'm not sedentary. Um, but I just don't want pain in my knee. Like I said, I'm fine with it being sore. I'm fine with it being weak. I just don't want pain. I do not do well with pain. Like last time I had pain in my other knee, I just didn't do anything on it for like a year or two. Like I didn't squat for like a year or two because it hurt my knee, and then randomly it got better. So if we could just do our best to not have actual pain, that would be good. And then let's see. So I got some other things. So in terms of which graft is best for you, if it didn't make sense while I was explaining this, here's a little synopsis of what the internet has told me or what I've accumulated from my research on the internet. So if you are a high level athlete, especially in sports like football, basketball, soccer, patella tendon might be your best option. However, it's going to give you a lot of knee pain, so you have to be aware of that. So unless you are like a pro athlete, or maybe you're a college athlete and you're going to go pro, and not one of those like I'm going to go pro and you don't play, like if you're actually like playing, you're trying to go pro, you make money from your profession, from your sport, that might be the best option. Now it says if you're a bodybuilder or a lifter worried about knee pain, you should do the quad tendon. Hamstring is going to be great for runners, and those who are a little less active. So yes, you run in a straight line, but you're not out there doing cuts. You're not doing a lot of explosive type of workouts. And if you're older and less active, they said the cadaver is the best option for you, but it also depends on your surgeon. So if your surgeon has never done a cadaver, probably don't want to do a cadaver with your surgeon. If he's never done a hamstring, probably don't want to pick the hamstring. You want to pick people who have done what you actually need, because that's going to be the most important part. So I don't know which one I'm going to pick, to be honest with you. I'm just here giving you the facts and then kind of just giving my opinion. I think personally, I know I'm not going to pick the patellar tendon. Like I said, I don't want pain in my knee, so that's just completely out the question. In my opinion, I think it's probably going to be between the hamstring and a cadaver. I don't want an enormous scar going down my leg, and I would like to preserve as much muscle as possible, so I would rather not touch my quad. At least on the hamstring, I won't see the scar. Pretty big pro to me. And the cadaver, because I don't have to, reconstruct my ACL from my own body. So there should be less recovery time, should be a lot less pain. The only thing I worry about is the ACL or the tendons or whatever I'm getting from this other person. Were they active? Did they treat their body right? Because there could be so many things. They could have been a habitual smoker, and now I have an ACL from a smoker that's not as strong as my other one, when I could have taken parts from my body to remake it. There's just a whole bunch of stuff, and I don't really know what I want to do. I just know patellar tendon is completely out the picture, because no pain for me. No thank you, no thank you. But that's kind of what I have. So when it comes to choices with the ACL, you have hamstring, quad, patella, or a cadaver, which is somebody else either donating theirs or from a deceased person. But that's kind of what I have. Like I said, I'm leaning towards the hamstring or the cadaver. I'm gonna have to have another consultation with my surgeon, and then I'm gonna get a second opinion, and then I'm also gonna ask my mom, because she's a nurse, so she should know all about this stuff, right? Yeah, that makes sense. But yeah, that's what I got. So if you are new to the channel, make sure you hit the subscribe button and the notification bell to get notified every time I post a video. And leave a comment in the comment section down below of, what do you think about these surgeries? Which one would you personally pick? Have you had surgery? Which one did you do? How are you feeling? Do you have full range of motion? Are you running? Are you back active? How is life for you? Because I know if you're able to run, it is probably a lot better than when you weren't. And just like that, I will see you in the next one. Peace.